Dr. Abhishek Shah, are you here?
Very good morning, and I'll be presenting my study on comparing the outcome of different hydrophobic IOLs in pediatric cataract surgery. Pediatric cataract is a leading cause of visual disability worldwide, and after the cataract surgery, the biocompatibility of the IOL is very important as it may influence the clinical performance in the short and long term in the children. One of the most common IOL material used is the hydrophobic material, which allows a lower rate of anterior and posterior capsular opacification. However, a higher rate of aqueous flare and inflammatory cell accumulation on the lens surface was noted. The aim of this study was to compare the outcome among different hydrophobic material following pediatric cataract extraction based on the development of visual axis opacification, post-treatment refraction, and uveal biocompatibility. We included children aged 2 to 12 years, and we excluded any children with the history of trauma, any treatment in the study eye in the previous 3 months, or any other congenital ocular anomalies. We recruited 41 children and operated on 78 eyes. After the preliminary examination, the patients were posted for surgery and distributed into two groups randomly. The first group was implanted with an acrylate methyl acrylate copolymer hydrophobic foldable IOL, while the second group was implanted with a acrylic hydrophobic foldable IOL. The surgery was performed and the patient was followed up post-operatively from day 1 to up till 2 years of post the procedure. Out of the 41 children, 24 were male and 17 were female. In the first group, it comprised of 37 eyes, and the second group comprised of 41 eyes. Mean age among the subject was around 47 months, that is 4 years of age. So the results were in 8.11% of the group 1 children, significant visual axis opacification was seen at the age of 10.8 months post-operatively. And in group 2, 26.83% developed significant visual axis opacification. So here we can see statistically that there was higher occurrence in group 2 for the visual axis opacification. Coming to the post-op refraction, after 1 month, we saw that 94.6% in group 1 and 100% in group 2 had post-op refraction within 3 diopters of the expected, but no statistical significant difference was seen. Again, for the visual acuity, after 2 years follow-up, 20 out of 37 in group 1 and 21 out of 41 in group 2 had a visual acuity better than 6/36, but again no significant difference was noted between the two groups. Coming to decentration at the 2 years follow-up, again no statistical difference was found between the two groups. The uveal biocompatibility between the two groups, we saw that in group 1 only one patient showed uveal pigment dispersion over the IOL, while in group 2 9 eyes had uveal pigment dispersion over the IOL, 3 had developed posterior synechiae, and 1 showed retracted inflammatory membrane. So here we saw a statistically difference, and the uveal biocompatibility of group 1 was better than the group 2. So to conclude, there was no significant difference between the IOL decentration, best corrected visual acuity after 2 years, and post-operative refraction between the two groups. But the acrylate methyl acrylate copolymer showed fewer rates of visual axis opacification, while the group 2, that was the acrylic hydrophobic foldable IOL, showed higher signs of uveal disturbance compared to group 1. These are my references. Thank you.
Thank you. Good presentation.
Thank you.
Why did you select supraphobe? Non-affording.